I'm Angela Meredith, and today I would like to talk to you about identifying victims of human trafficking in the healthcare setting. Okay, I want you to take a moment to picture the faces of some of the people you may come across day to day. Picture the kid who comes to your door to sell magazines or a household cleaner, your manicurist, the busboy in your neighborhood restaurant, the guy working on the new construction site downtown, the farm worker picking blueberries in the field. These are the faces of human trafficking. Now, most people think of human trafficking in terms of smuggling humans, and trafficking can involve smuggling, but it's more accurate to think of human trafficking in terms of labor. In other words, the exploitation of a human to work through means of force, fraud, or coercion. Now, this exploitation is rampant throughout the commercial sex industry, pornography, live sex shows, even mail order brides. Now, this type of human trafficking is called sex trafficking. But as I just had you imagine, it's also present in many legitimate businesses, and this is known as labor trafficking. Now, human trafficking is a massive global industry, and it represents one of the top 3 black market economies, right up there with drug and arms sales. It's a worldwide epidemic, and the U.S. is not immune. In fact, incidents have been reported in all 50 states. Now, North Carolina has consistently ranked in the top 15 states in the country for calls to the National Human Trafficking Resource Center hotline. Last year, we were number 12. So many of you may be asking, what does this have to do with you? Well, several studies have shown that the majority of these victims have had some healthcare contact during their captivity. A 2014 study put that number as much as 88% of victims have had a contact with a healthcare professional during their captivity. Now, most of the victims present to emergency departments and urgent care centers, but they also present to Planned Parenthood, OBGYN clinics, primary care providers, and your dentist. All right, let's look at a case study. 16-year-old white female, Jill, presents to the emergency department with severe vaginal bleeding. She's accompanied by her older brother, Bruce. Now, Bruce alerts the staff that Jill is schizophrenic and pregnant, and the family fears she may have tried to induce an abortion. He seems very concerned for Jill's well-being, is helpful with answering questions about her medical history, and is constantly by her side. After an emergency surgery, Jill is placed in a locked psych ward for recovery. During her stay, she appeals to the staff for help and says she's being held hostage by Bruce. However, given her history of schizophrenia, her statements are dismissed as hallucinations, and they are not taken literally. 3 days later, she is discharged back into the caring hands of her older brother, Bruce. Now, in reality, Bruce is not her older brother, he is her trafficker. And when he discovered Jill was pregnant, he instrumented her with a broken bottle to try to induce an abortion. And when she subsequently began to hemorrhage, that's when he took her to the emergency department. Okay, so why wasn't Jill identified as a victim of human trafficking while she was in the hospital? You know, there are several barriers to identification that exist on both the provider side and the patient side. Providers may not recognize victims due to a general lack of knowledge concerning human trafficking. There may be cultural misconceptions, or they may not be using trauma-informed care. Patients often simply do not self-identify. They may fear harm will come to them if they tell somebody about their plight. They very often distrust authorities, and most have no knowledge of their rights as a victim, and they may fear deportation. Now, North Carolina follows federal law that guarantees protective rights to victims of human trafficking regardless of an immigration status. So even if they're here illegally, if they're a victim of human trafficking, they will not be deported. All right, so what are the things you can look for to help you identify a victim of human trafficking? You might think of the acronym OBSERVE. Take note if your patient is overly submissive, especially to the person accompanying them. If there is a buddy present who constantly speaks for the patient, that buddy is oftentimes either the trafficker or a trusted agent of the trafficker. If they exhibit signs of physical abuse, if they do not speak English or do not speak it well, if they cannot show you a form of identification, traffickers very often will confiscate IDs, travel documents, anything they can in order to maintain control of movement over their victim. If they have a variety of health issues that have gone unaddressed, like malnutrition, poor dentition, various dermatoses, if they cannot tell you about their last well exam, or if they exhibit fearful or guarded behavior, whether it be toward you or toward the person that is with them. There are also some red flags to be aware of too. Number one, a discrepancy between the stated history and what you are seeing in your patient in the room. If they are dressed in clothing that is inappropriate for the weather, they are not oriented to place. They cannot tell you the hospital they're in, the city they're in, the town. If they have a history of recurrent sexually transmitted infections, history of frequent or forced abortion, if you find trauma to the vaginal and or anal areas. Now for sex trafficked minors, there are some specific red flags that you need to look for. Number one is seemingly excessive number of sexual partners for their age. If they seem overly familiar with sexual terms and practices for their age. A biggie here, if they appear younger than their stated age. If they are reluctant to talk about a particular tattoo. A lot of times traffickers will brand the girls, nape in the neck, right inside the mucosa of the lower lip, someplace that's not all the time obvious, or there may be a specific word on her shoulder she doesn't want to tell you about it, or if there's a history of truancy or running away. Now, if your patient is a minor and they are engaged in commercial sexual exploitation of any form, even if they say it's by their own consent, like it's survival sex or trading sex for food, for shelter, by law that's considered human trafficking. So 17 and under, if they're engaged in pornography, it doesn't matter. It's considered human trafficking by law, okay? So what are your next steps? We'll notify hospital security if it's appropriate, and then call this number. It's a national hotline number. The National Human Trafficking Resource Center is a national anti-trafficking hotline and resource center. This toll-free number is answered 24 hours a day, 365 days a week, both in English and Spanish. It's answered live. They also have an additional 200 languages also available to help give guidance. Now, staff members are trained to speak with healthcare providers in a manner that is HIPAA compliant, and they will guide you to next steps. If you want to pass this number along to your patient, they will guide your patient through next steps. Now, far too often, these victims of human trafficking present to us seeking care for what may seem like a simple STD or an occupational injury, when in fact we treat them and send them out the door without ever recognizing them for the victims that they are. These people are truly hidden in plain sight. I urge you all to get more education so that you can learn to better recognize these victims. SOAR to Health and Wellness, it stands for Stop, Observe, Ask, Respond. There's a pilot program going on right now in North Carolina that's specific to healthcare providers. If you go on their website, you can see where they have webinars available, in-person training available. The U.S. Department of State offers human trafficking awareness that is not specific to healthcare providers, but it can help you overcome some cultural biases, perhaps, if you see a patient, because it's not just sex trafficking, it's labor trafficking too. And then Massachusetts General Hospital has a guidebook you can download for free from the web. That one is specific to healthcare providers. Very detailed, a lot of good information in that. For so many of these victims, we represent their first and probably their only opportunity for rescue. So let's not let them down. Thank you.